Good morning, everyone. Good morning. My name is Karen Moore, and I reside in Savannah, Georgia. I'm a caregiver of my mom. I've had her since November of 2008. I am a sepsis survivor and a widow of a sepsis victim. The weekend of May 1st, 2009 changed the course of my life forever. My husband and I had an opportunity to share one of the greatest and most amazing weekends together. Little did I know that that weekend would be our last weekend. On May 5th, 2009, I lost my husband, my best friend, my soulmate, my business partner, and the love of my life. James succumbed to his illness at the age of 43 years old. Within hours of not being properly diagnosed and treated, James' organs and systems started to fail, and his body slipped into septic shock. 19 hours after being transported to the hospital, my husband met his demise. Fast forward to 2016, I was hospitalized and almost lost my life to sepsis. I spent 9 days in the hospital and another 15 days at home connected to an infusion pump that administered antibiotics 24/7. This resulted in over $60,000 in hospital debt, plus another $11,000 in antibiotics to run through this pump. And it cost me a year of my life rehabilitating. Sepsis has had a devastating impact on me, not once, but twice. Unfortunately, I know the physical, psychological, and emotional and financial burdens that hospitalization and illness brings. As a result, I have become relentless in bringing sepsis as well as being an advocate and a voice for sepsis patients and their families. Currently, I'm working with local lawmakers to bring mandated sepsis protocols to Georgia so that Georgia can become sepsis safe. Sepsis accounts for $26 billion in annual costs, making it the most expensive condition to treat in the U.S. healthcare system. I have had the opportunity to connect with countless families, one who in particular who lost their 7-year-old daughter. And what is so devastating about her death is that, and along with James, it could have been prevented. Gabby's cost of care was over $500,000. And if we had mandated, she lives in the state of Illinois, if there were mandated protocols in place, I'm almost certain that that little girl life would have been spared. So what does state mandated protocols have to do with cost of care? These protocols not only save lives and reduce mortality rates, but it's important to helping to reduce financial burdens on their families. For example, in Gabby's case, if she was properly diagnosed correctly, it would have been a matter of $200 to $300 in blood tests. And if she had to be hospitalized, maybe 4 to 5 days, that cost would have been $25,000 to $30,000, with the likelihood of full recovery and the opportunity to go home with her family. Because she went misdiagnosed for so long, this not only costed her family the financial hardship, but she paid the ultimate price and they lost their beautiful daughter to sepsis. So that's why I'm passionate about being an advocate. That's why I stand before you today. My husband and Gabby and countless others lost their voices, but I still have mine. And I will continue to do this so no other family have to go through what I had to endure. Thank you so much.